Can we start the session, sir? Ma'am?
Yeah, please start. Dr. Nikhil again has disappeared. I don't know where.
No, I'm here only, Moshiji.
Yeah, we can't see you.
Yes, just a minute. Okay.
I think
I'm
Dr.
in now.
Yeah,
yes.
Good afternoon, everybody.
Good afternoon, everyone.
Can you just wait for Rohan 1 second? I'm just seeing. I'm
Yes.
just to the.
He's there.
Yeah, and just now they're all coming in.
Yeah, Dr. Nikhil is there.
Hello, good afternoon, everyone.
Yeah,
Yes.
I was there, but I don't know, I was waiting outside. Hello, guys. How are you
We
doing?
had to
Hi.
allow one by
Hello,
one.
sir.
Hi, Rohan, Nikhil, Sharat, Antarmai, Mosmiji, namaste.
Hello.
Hello, ma'am. Hello, all, three of my sirs. Hi, Antami.
Oh.
How are you doing?
Yeah, good, very good.
Good to see you. I think Dr. Sharath, you can
Alright.
start now.
You can start,
Yeah.
ma'am? Yes, ma'am.
Yes,
Okay.
yes.
A very good afternoon to one and all present here. This brings us to the last session of virtual PedoRaRe version 3.0. This session will be on advanced pediatric dentistry and MDS exam preparations. We have two VIP moderators here, our President Mausimi ma'am and our Secretary General Nikhil Srivatsav sir. We are honored to have both of you here. We know that you're busy, but accepting our invitation to be the moderators for this particular session. We have three speakers for this particular session: Dr. Antamai, Dr. Nikhil, and Dr. Rohan. I have the privilege and honor to introduce our first moderator, Dr. Mausimi ma'am. Mausimi ma'am did her UG and PG from King George's Medical College, Lucknow. She has more than 26 years of teaching experience. She is currently the professor and head of ITS Dental College, Greater Noida. She was the organizing chairperson of the 41st ISPPD National Conference held in November 2019. She has delivered numerous guest lectures and invited talks in national, international conferences and CD programs. She is currently the First Lady of ISPPD, the President of ISPPD. We welcome you to this particular session, ma'am. Thank you, ma'am.
Thank you very much, Dr. Sharath, for your kind introduction. Thank you.
It's my honor to introduce our dynamic Secretary General, Dr. Nikhil Srivatsav sir. Sir is the Principal and Professor Head of Pediatric and Preventive Dentistry, Subharti Dental College and Hospital. He is the Dean Faculty of Dental Science, Swami Vivekananda Subharti University, Meerut. He is a member of the Dental Council of India. He is an international dental advisor of Royal College of Physicians, Surgeons, Glasgow. He is a board member, Science Committee of IAPD, and he is a member expert group of NABH, National Accreditation Board for Hospitals and Healthcare Providers. Thank you so much, sir, for accepting our invitation.
Thank you, Sharat, for such kind words and introduction. Thank you.
Over to the moderators to introduce our first speaker for the day.
So, should I, with the permission of the President, should I introduce the first speaker,
Yes,
Dr.
yes, sir.
Antarmai
Yes, sir.
Panigai?
Please go ahead. Please go ahead.
Yes.
Okay, so Dr. Antarmai pursued her BDS from MS Ramaiah Dental College, Bangalore, and thereafter MDS from JSS Dental College, Mysore. She is a proud recipient of 10 gold medals for securing highest marks and best outgoing student in BDS and distinction in her MDS. Undergraduate certificate of merit from Perry Fauchard Academy, she got in 2009. She's also got observership in pediatric dentistry from New York University College of Dentistry, and she's been speaker at various national and international platforms and won 7 best scientific presentations so far. She has over 40 national and international publications to her credit, along with 2 patents, and presently working as associate professor at Institute of Dental Sciences, deemed to be University SOA, deemed to be University Bhubaneswar, and she's also pursuing her PhD. So welcome, Dr. Antramai. The floor is all yours. You can start your presentation.
Thank you, sir. A very good afternoon to everyone.
So to start with, most commonly minimal intervention dentistry, MID, minimal invasive dentistry, air abrasion and lasers in pediatric dentistry have been either asked as a main question or as a short note. So depending on the time and the marks allotted, you have to accordingly frame your answers. However, there's a small trick in this question, so you have to read the question paper very carefully, whether
Audio is not there.
Sai, can you play it? Sai?
advances and literature review and finally the conclusion.
Let us play it from here.
So to start with,
Can you hear
most
them?
commonly minimal intervention dentistry, MID, minimal invasive dentistry, air abrasion and lasers.
A very warm greetings to one and everyone, and let's quickly start the rapid revision for the question with minimum intervention dentistry and lasers in dentistry. So to start with, most commonly minimal intervention dentistry, MID, minimal invasive dentistry, air abrasion and lasers in pediatric dentistry have been either asked as a main question or as a short note. So depending on the time and the marks allotted, you have to accordingly frame your answers. However, there is a small trick in this question, so you'll have to read the question paper very carefully, whether it is asking about minimal intervention dentistry or it is asking about minimal invasive dentistry. Because if it is asking minimal invasive dentistry, it is a part of the minimal intervention dentistry. So it is a restoration where we're doing in a minimal intervention way. So read the question carefully, whether it's asking intervention or invasive dentistry, and accordingly write your answers. Like any other question, you'll have content, that is your introduction. You'll have the history and evolution of MID, the concept, strategies and application, recent advances and literature review, and finally the conclusion. As we all know, there has been a paradigm shift from the surgical point of caries management to the medical management, in which we mainly focus on early prevention and interception of disease. Going to the history, Mount 1991 coined the term minimal treatment. Dawson and Mackinson termed the coin minimal intervention dentistry. However, it mainly became popular only after the FDI policy review in 2000. And the most common guideline that is given by Franken et al. In 2012 is what it's mostly followed. With a more understanding of cariology, it has become very clear that dental caries is not a defect or a lesion. It is basically a disease process, a process which occurs over a period of time in which there is a cycle of demineralization and remineralization, and the final outcome depends on the balance between the protective factor and the harmful factor. So the development of a surface cavitation, which occurs in a very late stage of caries process. So in the entire process, we have multiple places where we can intervene, where we can stop the caries process and reverse it to the normalcy. So basically, MID is nothing but a risk-based, patient-centered preventive approach. Make sure to have these key terms in your answer sheet so that it makes your answer of more weightage. There are mainly 4 philosophies of MID which you'll have to elaborate depending on the marks allotted. First is recognition, remineralization, restoration, and repair. And recognition mainly deals with identification and risk assessment. Remineralization is basically a term which indicates that all the efforts are done in such a way so that the demineralization is restricted and there is no net loss. So that can be either done by biofilm disruption or modification so that we can arrest or reverse the lesion. If both the effect fails, then we come to the restorative part of MID, which is nothing but the surgical or the operative intervention, which is basically called as micro-invasive dentistry or minimal invasive dentistry. So if the question is about minimal invasive dentistry, your answer will remain same till here, and then it will proceed only to the restorative aspect. Then is your repair to the defective restoration. Recognition has basically two components, that is diagnosing as early incipient lesion as possible, for which there are various indices like ICDS 1 and 2, Mountain Hue, which is more of a clinical picture. You have NAVAD index, DMF index, CAST index, that is nothing but your caries assessment spectrum, PUFA index, and various recent diagnostic aids which help in the diagnosing the incipient lesions. Also, caries risk assessment, basically to see what are the harmful factors which are aiding to demineralization. So, as you can see, you have something called as ICDS. I have just put these pictures so that it retains in your mind. There is ICDS system, there is Mountain Hue classification, and as per the data says, ICDS 2 and the PUFA index is being more promptly used on the field for the caries activity, and the CAST index have a higher validity and reliability. As I've mentioned, there are various recent diagnostic aids which help in early diagnosis, like more advanced digital radiography. You have fiber optic transillumination, which is more prominently used for proximal surface. You have Diagnodent. However, it is not that valid for caries detection, but it can quantify the plaque. You have QLF-based equipment so that you can detect and quantify the enamel caries lesions. You have caries scan, which is based on the electrical impedance. However, most of the studies have told it is not very reliable in children. You have also Canary system. However, this system needs more of the elaborate clinical data. These are the methods how we're going to do the risk assessment. There are certain models and tools. One of the tools which is suggested by Walsh is the STEM, which is a system for total environment management. Basically, this is going to assess the health of an individual, the attitude, the food habits, the disease status, the characteristics of saliva and plaque. Similar is your wheel of misfortune, which is going to basically see, as you can see, the red marks are the things which is going to cause demineralization and the protective factors. You have also certain kits like saliva check buffer and saliva check mutants to assess the flow, pH, buffering capacity, and the keriogenic potential. You have plaque assessment to check the thickness, pH, and quantification of the plaque. There are also various models like Canberra, CAT, and karyogram to basically come to a conclusion that what is the risk of the individual. Second is nothing but your reduction or demineralization. All the efforts in this stage is basically intended to reduce the chances of demineralization and loss of ions, which can either be done by the antimicrobials, so by targeting the keriogenic bacteria, or by using non-keriogenic sweetener, which is not metabolized by the keriogenic bacteria, probiotics by replacing into the non-keriogenic, or at the mineral aspect where we can increase the concentration of the fluoride or the non-fluoride based supplements so that there is no net loss. As you can see in the image, you have non-keriogenic sweeteners, xylitol and sorbitol candies and lozenges are used and have been proven to reduce the proximal caries. You have something called as Cavistat, which are arginine-based products. They have also been very effective in arresting and reversing the caries. You have something called as probiotic, which is nothing but the replacement of the keriogenic bacteria. You have demineralization. I need not go into details with the fluorides because we all know the fluoride helps in demineralization by stabilizing the crystal structure, reducing the solubility, and you have something called as 38% of silver diamond fluoride. However, we need further studies concluding more on the SDF. We also have the non-fluoride remineralization, and all these components or all these products are basically aimed at increasing the local concentration of the ions so that there is no net loss of the ion when there is an acidic attack from the enamel lattice. So it can be either CPP, ACP, or a calcium sodium silicate or unstabilized, or there are certain methods which are still on horizon like TIF technology or tricalcium phosphate. If all the efforts of the remineralization fails, we also have something called as plaque disruption, which can be done by a mechanical oral prophylaxis or by use of ozone, which by water or gaseous, it can be used as an adjunct, not as a sole purpose, but as an adjunct. If everything fails, we land up in something called as minimal invasive dentistry. We'll have to restore when there is a established cavity. At that point, also we'll have to target those lesions as minimally as possible. So we have alteration in methods and we have alteration in materials as well. So we can approach or do the caries removal by air abrasion, laser, chemomechanical, fluorescence assisted, or using the minimal burrs or changing the design. There are also different restorative techniques like ART. We have something called as preventive resin restoration and sealant as well. Also, the choice of material will change because we need to address it minimally and more smartly. So we have the glass ionomer cement, we have the smart materials, resin infiltration, and also the Hall technique. So coming to, as I told, air abrasion, one of it, ultrasonics, we have a laser assisted, then the technique called as water lace. We have something called as self-limiting burrs, which are nothing but the polymer or ceramic burrs. However, it is shown to under-prepare. We have fissuratomy burrs. We are very thin, small-headed, and Mount in GJ in 2005 also gave certain alteration in the design of the captive preparation, whether it can be tunnel or slot, depending on where the lesion is present. We have something called as chemomechanical caries removal, where the chemically assisted, we are removing all the necrotic organic tissues and then replacing with the restoration. So we have Caridex, which is almost obsolete, Carisol, Pepacari, and also fluorescent assisted caries excavation, which has been done with the PEPN. Once we have prepared the cavity minimally, next thing is to choose the material so that it is adhering chemically, so that a bond is stronger and more long lasting. Also, more smart materials. So we have GIC, we have modified GIC, we have fluoride based, and we have CPP based as well. So as you can see, these are the different techniques that we follow in MID. That is the pattern fissure sealant, resin infiltration, PRR or the preventive resin restoration, and Hall technique. Hall technique is also being used in addition with ozone and in addition with laser, but still there is no proven guidelines till now. However, Hall technique is still a valid method of MID in pediatric dentistry. There are certain advances also. We have more advanced enzymatic caries removal still on advancement. And we have air abrasion with bioactive glass. We have remineralization with ozone. We have laser and fluoride, so that laser helps in 4 times more uptake of fluoride onto the surface and aiding in surface protection of enamel. We have Hall technique with ozone. We have hydroxyapatite with xylitol. So all these methods are on horizon and still yet to be developed as a guideline. So my conclusion with MID is I have just tabulated all the methods of caries management with their conclusion, which is followed now, and the relevant scientific literature and references, which at least you must have in your answer sheet whenever you're answering MID. So the next is nothing but a laser in pediatric dentistry. As I told earlier, depending on marks and depending on time, you need to divide how much content you're going to give in your subheading. So you need to have introduction, you need to have history, you need to have a brief of laser physics, classification, safety and hazards, application, advantages, disadvantages, obviously recent advances if any, and conclusion. So as we all know, laser is an acronym which stands for light amplification by stimulated emission of radiation. This is nothing but an electromagnetic radiation of uniform length, phase, and polarization stimulated by external field. Basically, this is monochromatic, this is coherent, intense, and a collimated light. So if we get back to the history, in 1917, Albert Einstein itself had a concept of light, which is the maser. However, only in 1965, Stern told that ruby laser can vaporize enamel. In 1990, first dental-specific laser came into existence. However, it took a lot of advancement. Only in 2013, the Council of Clinical Affairs recognized the use of laser in dentistry, and it is now recognized by AAP. So laser physics is quite an elaborate topic. So if it's a main question, you have to go in detail about the absorption, spontaneous emission, and stimulated emission. If it's just short note, you can just briefly mention. You need to also mention about the tissue interaction like absorption, transmission, scattering, and deflection, because these are the basis of application. So if it's a main question, you have to explain it. If it's just short note, you can briefly describe about it. Coming to the classification, based on active material, it can be gas, solid, or liquid. Based on the wavelength, it can be invisible, ionizing, visible, or invisible thermal. Based on the operating mode, it can be the continuous laser or a pulse laser. If based on the power supply, it is low power or mild power. Compared to the delivery system, it is either flexible hollow tubes, articulated arms, or fiber optic. Based on clinical uses, it can be based on diagnosis or a soft tissue laser or a hard tissue laser. After which, a most important point which you need to elaborate is the laser safety. At least make sure you have the word something called as laser plume, which is nothing but the gas and the residue, for which clearance you need a high speed suction. All the palliative therapy has to be done if you're treating any viral lesions, specific protective eyewear, and laser filtration mask or laser plume. The most common laser hazards are ocular damage or tissue damage. Respiratory issues might rise up because of laser plume. There might be fire and explosion and electric shock. And these are the safety guidelines which is given by NCZ 136. Coming to the application, I have just mentioned and categorized it. Again saying, depending on the marks, you have to elaborate about the timing, about the wattage, and about the pulsating. So the soft tissue application is endodontics. Can be used in diagnosis by Doppler flowmetry. Indirect and direct pulp capping. Erbium laser have been used profoundly with more than 90% success rate in pulp healing. Diode laser have been used in pulpotomy. Now there has been some limited use in access cavity preparation as well. Coming to the surgical, you have soft tissue lasers for mucous relaxation, cyst denucleation, frenectomy, ankyloglossia, tooth exposure, gingivectomy, and all of it is very advantageous because you need minimal local anesthesia, is more comfortable to the child. For pain relief, you have Herbus labialis, you have abscess ulcer, and you have leukoplakia. Coming to the hard tissue application, you have diode laser and fluorescence-based caries detection technologies for incipient caries. You have erbium YAG lasers for caries removal. Olivier et al. In 2009 gave this thing because laser in combination with fluoride has been used profoundly, and it has been found that it increases the fluoride uptake into the enamel lattice up to 4 times. So it basically stabilizes the surface of the enamel. It has been used in cavity preparation. It has been used in composite curing. You have a concept, something called as laser pediatric crown. However, it is not widely used. It can be used for tooth preparation and removal of the old restoration because it will have least amount of the residual. You have something called as low-level laser therapy, which is most commonly used in orthodontic tooth movement or if there is any pain episodes in the eruption. You have dental traumatology for the uncomplicated and complicated fractures. It has also been used for the bleaching of vital and non-vital teeth. As I've mentioned, advantages, it is selective and precise. It is less necrosis of adjacent tissue. It has a faster wound healing. It needs almost no anesthesia, reduced chairside time, pain relief in abscess ulcer, no noise or vibration, and since it's a non-contact mode, it is more easily used to be anxious children. Disadvantage, however, it is very expensive and not one laser suffices all the needs. So we might need to have 1 or 2 laser sets for all the purpose. Most of the laser tips are both side and end cutting, and it needs specific education and training. It needs modification of techniques accordingly. However, the advances on the frontier is there has been combination use of laser and fluoride. You have laser assisted irrigation, you have Hall technique in association with laser, and you have profound use in regenerative endodontics. And in one of the systematic review by Pahaoyu in 2020, they have told almost 100% success rate of healing of exposed pulp when as compared to the other material. So good luck for your exams. Read your question properly, make your content, and accordingly fill the contents depending on your exam times and marks. Thank you.
May I now request Nikhil sir to introduce the speaker for the day, Dr. Rohan.
Okay. So once again, good afternoon, Jai Hind, everyone. It is my pleasure to introduce another speaker, Dr. Rohan Bhatt. Dr. Rohan Bhatt completed his Bachelor of Dental Surgery course from Bharati Vidyapeeth, Pune, and then MDS in Pediatric and Pediatric Dentistry from KM Shah Dental College, Vadodara. He is also the additional director of Karnavati School of Dentistry, Gujarat, India, and he's pioneer of exclusive pediatric dental setup by opening first ever pediatric dental hospital in 5,500 square feet area named as Vasu Pujya in the state of Gujarat, which has been awarded as best clinic in India in 2015. Right now, Vasu Pujya has 2 active centers across Ahmedabad and Mumbai. He has 38 international and national research papers publication to his credit, including the British Medical Journal and Frontiers. Dr. Rohan Bhatt is a key opinion leader for 3M SP, Colgate, GSK Pharma, and Concert. He is highly acclaimed speaker for his clinically relevant presentations and actively conducts CD courses on various topics of pediatric, preventive, and restorative dentistry. So I welcome Dr. Rohan Bhatt. The presentation is all set for you. Please start your presentation.
Thank you so much, sir, for a lovely introduction and nice words. It's so good to see you in person. Pleasure is as pleasures all are. Before I begin, I would like to, because this is what I always make a mistake of, thanking people who created this amazing concept of rapid revision. I'd like to say thank you to Mosri Madam, the president of ISPPD, a nicely said first lady of our community. Dr. Nikhil sir, as always, supportive for any task and outstanding. But one guy who was relentlessly after me, Dr. Sharath, I would like to acknowledge your offer. It has been fantastic thing. 3 days, my students are attending it. They are learning it. This is an amazing thing which you pulled off from KSR Institute itself. And I wish you success for many other things to come in your life. Thank you so much, Dr. Sharath. As I requested, the topic is very, very different than what I normally speak all the time. Sir, I've been taking conscious sedation, zirconia, and what all practice management since a very long time. This is a unique topic, but this was very, very near to my heart. You know, sir, why? Because when I was in my postgrad, I was not an amazing student like people used to score marks, but I was that kind of a student who used to read and produce well. So this school always asked me that why the hell you get better marks compared to what we have studied in our time, because we all have studied almost similar. And that came to my mind that to create a concept called the deep dish. The deep dish means everyone prepare a dish in their culinary concept. Now, what do you mean by that? So we all we all have to form a recipe in order to create an ultimate dish. And the recipe cannot be different while you want to prepare the best dish ever. Let's say a pizza or a donut or something like that. So you have to get deep dive in it in order to produce each layer, each ingredient at the right time. And in today's presentation, I'm just going to walk you a small journey that how an individual, maybe a first year student or a second year student, prepare himself or herself in a way that whatever you guys are studying can create an ultimate deep dish for you. So let's begin with the thing. I love this quote. I wrote it a lot of years ago, about 5-7 years ago, that there is no short formula of success. I don't know that. There is no short formula of success, which I can't give you. But I can tell you what's the formula of failure, because I've failed 100 times in my life and I've keep doing and trying it. The word I used for Dr. Sharath here to praise him, his efforts, was relentless. The way you become after something and you keep doing it, the formula of success decodes itself. There is no other than that. The textbooks are same. The articles, the materials are same. Okay, the libraries are more or less same in every dental college today. Maybe some people have more index journals, or some people have online journals, or this and that. But ultimately, it's up to you what you get to do in that 3 years of life, and then you reproduce it in those 3 hours. And to do more well in detail, we'll go further. I love this. Before we get into any kind of things, I get a lot of people for mentoring session and this and that. I always tell them one thing: if you want to do this nicely, if you want to make it successful, the most important thing for you is to follow PhD principle. For me, my PhD principle is pretty simple: passion, hunger, and determination. We get to meet so many people nowadays, guys. Maybe there must be amongst you that they are in first year or second year in third year. After reaching to half of their curriculum, they realize this science, what they are reading, is not for them. Pediatric dentistry is not for them. But guys, I can tell you, is pediatric dentistry is not as common, as general as what other branches are offering. This is a unique branch. You must love this. Otherwise, it's going to be very difficult to survive and keep doing the work for your lifetime. So guys, the first thing what I'm going to tell you is to have the passion of this field. If that passion quotient is missing, then it's going to be really difficult for you to push yourself to next level. The second thing is the hunger. If you guys are not hungry enough to learn and try new things, because here we don't limit ourselves with only one small area of dentistry. Pediatric dentistry is actually some of so many other branches. So you have to be hungry in order to get knowledge and learn something, unlearn your own matter, relearn your own matter, and go ahead with that. If you get stuck, there is nothing like that. And with all these things, the last principle is determination. If you are not determined enough, then you will not survive in this branch. This is the core principle, which is, I would not say missing, I would not say it's difficult to find. No, you'll have to find it yourself amongst you, that do you have the PhD for this particular branch, what you are talking? Yes, then rest of the things I'm going to explain today is going to be a cakewalk for you, because you felt it. You've been there. You've done that. And there's nothing new about it. And especially in the kids who are studying in first or second year beginning, because this is a time of transition, you must have this. If you have this, your rest of the life is so easy, because there will be a lot of passion doing each case. There will be a lot of hunger, learning new things for each case. And there will be a lot of determination to do it 100% every time when it is required. So guys, this is absolutely must to have it. PhD principle. Moving on with that, as my fellow colleague, Dr. Nikhil Marva, my dearest friend, is going to explain the practical part of it, which is actually the most tough, because you are genuinely facing a human to answer. Here in theory, the one best thing of theory is it doesn't matter where you are, from where you come from, what you're wearing, what your outlook would be, how you've been through it, nothing. It's pure and pure you. It starts with you, it's end with you. The beauty of theory exam, guys, people get feared in theory exam. I get to meet so many people in theory exam. They say, so we are very scared of theory, but I'm very comfortable with practical. Bolna hi to hai. I just have to go and speak. I can explain myself, but I'm really bad when it just get confined within those particular questions with that pen and paper. But guys, that's the best tool, because it get confined. The area can become so narrow, and you know you are going to produce in next 3 hours. The template is given. So you know what you are chasing. But in Viva, it's so difficult. Every first question determines what's going to be a second question, because your answer has another question in that. And then how you're leading, it's a part of your communication skill. So you'll have to activate your brain with your communication skill, the half part of the science and the full part of confidence in order to talk there, which is extremely difficult, guys. But compared to that scenario of the half an hour, 45 minutes, 1 hour, whatever the time, this 3 hours is fully yours. You and only you are there to write your answer sheet. So only you can make it, or only you can break it here if you will not be in the right frame of mind. So guys, before I get into how to write it, the most important thing nowadays is to how to remain in the right frame of mind. So preparation, guys, starts from day one. People feel, I've been into teaching since multiple years, more than a decade and a half. And students come to us, sir, we need a preparation leave. मैं बोला, why? सर एक बार घर पे बैठेंगे फिर हम प्रिपेयर करेंगे. मैंने MDS के लिए क्या preparation? There are no particular textbook. There is only a confined syllabus, means topics to read. The preparation starts from day one. It's just some of the things you want to revise, some of the things you want to compile that you could pull off in last couple of days. But guys, if you'll pick up your book at the last month or maybe 10-15 days, you're just glancing the pages because the things should have rooted in you has not inculcated yet. It can only inculcate if you start early. I know it could be very wrong, this thing to explain at this point of time for the people who are going to appear this year. But I got to know that there are a lot of registration has happened who are in first year and second year. They are highly interested in order to get into the process of building up a right kind of an answer sheet. Let it be any difficult paper on the earth. And that is why I'm telling you guys, the preparation starts from day one. Each seminar has a value to it because those 15 seminars as a part of your DCI's curriculum is a 15 set topic is in your brain because you work really hard behind it. Those another 30 seminar topics of your fellow colleagues, if you're in a 1 unit system, let's take an example of it. Those 30, you've gone through it, you heard it, personally understood it. So let's say about 40-45 topics you are sorted with. With time, the kind of cases you do, you're going to prepare your case presentation to cases. So those small topic is also started getting incorporated into that. So it's like building up like a layer cake. And on top of it, your whipped cream or a cherry is going to be your journal club and other discussions, which your faculty is taking with you day by day, is preparing you for next level that, okay, this was contemporary. The technique tha, people were using with this way of working. But now what is latest or how people have tried and what's the success rate of this material, this technique, etc. So that's how you can build an archive here. And last couple of days are purely for revision because you cannot go to war by preparing yourself for 5 days. It's a month's preparation. It's your whole year's time which is devoted to this. And that is why going back to that part of explanation I gave you about PhD principle, about passion, hunger, and determination is makes you unable to appear exam like you are having exam next day. That's how your each day goes. There is no separate preparation for exam. This is not undergrad, guys, that your syllabus is there. Your best friend or senior marks you most important questions, or you can go to your university library and get last 5 years or 10 years question paper. See what is the most commonly asked question, read those and just vomit it there. This place doesn't work. This is master's program. That is why it is spread so far. But the problem it is spread so far, but the moment you start in a year 1, maybe in a 6 months, you have that fire to do it every day. But with the amount of time you get sink into it, it just keep loosening up. Okay, we'll do it tomorrow. Kal to aayega, parso aayega, Monday se start karta hu, agle mahine se start karta hu. Now there is a festival. Now I'm going home. Let me come back. I'll start. And then that day doesn't come. And you don't get in middle to pick it up. It's like you were hitting any gymnasium every day and the momentum you lost, now you're not getting back to it because there is no reason you're finding to motivate yourself. So guys, I always say this thing, never motivate yourself to do something, because the moment your motivation goes away, your whole momentum goes down. But remain inclined. That inclination will drive you every morning to do the work which you have done yesterday, to do it 1% better today. And that is only the key to success. Because as I mentioned before, Syllabus in pediatric dentistry is endless. If you see caries, there are books written over it. If you see habits, there are books written over it. Half of our syllabus is intermingling with ortho or endodontics, or maybe a couple of things in periodontics, or a couple of things of oral medicine and radiology. We must also learn how to read a CBCT, to how to perform a minor surgery, how to take sutures, to how to place a crown, to do a different preps, to do a permanent RC, to do a deciduous pulp therapies, to do restorations, to deep, to IPCs, to DPCs, etc., and everything, even in your clinical scenario. Plus, we also deal with a lot of special healthcare needs people. So that's hold together a different ballgame, guys. So there is no confined syllabus which you can sit with a textbook and finish it. Here, every textbook, some part is absolutely relevant to us. So guys, study for yourself, not for syllabus. Study for your satisfaction, not to get marks. Study for your best achievement in life, not to get a gold medal. If you do all this thing well, rest of the things may come to you, but will become stationary. Because if you are just working hard for those couple of marks, the day you will get a little less, you get demotivated. But if you're inclined to do good every day, and as I told you, 1% better every day, then that one lesser or 3 higher will not motivate you. The only kick which you will have is your own inclination. And that inclination will make you do it persistently each day. And how? It's simple. I love Wilfredo Pareto's principle. Wilfredo said, everything is related to 80-20 in life. You can Google it. There are books written over this. There are a lot of videos made over this. A lot of gnan on Google about it. But that's the rule of life. It's simple. Let me explain you in a normal day-to-day example is your 80% efforts gets you 20% result, and your 20% results get you 80% of the outcome. Oh, sorry, 20% efforts will give you 80% of the outcome. So हम जो चीज करने के लिए पूरा almost दिन पीछे पड़ते हैं, वो 20% में आता है, और हम जो 20-30% के effort देते हैं, then the major comes out as a chunk. Maybe it's in terms of money, in terms of work. So many times it happens that you are putting efforts for any question for 80 minutes to an hour to, let's say, 3 hours. But maybe you will be able to produce an outcome of 20%. But which you have just read it once or twice, you can produce it well. So guys, stick to those 80-20 of the ratio. Don't get disheartened that I did so much hard with that, and don't get stuck with it. Just focus this and believe in this rule. And because on this rule I believe in, writing paper is never a science. Because we all are science grad people. We believe in the core fact of science. It is not. Writing paper is an art. The same answer, if I will write it differently with the same content. And example, Dr. Sharath may write it differently. Or may example, Dr. Nikhil may write it differently. Content is same. But the reproduction of that content, it changes, depends on the individual. But the way you represent your knowledge, that is an art. And that art can get you good marks, can get you good applause, because that is what you need to learn. So you may know 80% out of that, but the art is to produce 100% out of it. And that we go to, my friends see it in later part of the slide. Now, before I begin more core into it, let's understand a fundamental thing. Time and marks division. Why do I do that? And why do I say this? Because I meet so many talented students. They know so much. They're not able to finish the answers. They're not able to finish the question paper to write. Finish all the answers. Why? Because they were knowing everything. The biggest challenge is, guys, I'm telling you, if you know all the answer is the biggest trouble. If you don't know your 20% of the paper, you are sorted because you're going to play around with that 80% and that you can produce well. But the moment you know 100% of it, The problem starts there, and then to finish the paper in the stipulated time of 3 hours, guys. I don't know who's invented this 3-hour theory, but it's fantastically well. 1 or 2 is too less and 5 is too much. 3 is perfect. That's what I always believe in, right? 3 is perfect. So it is what it is, guys. We are not here to change anything and accept it the way the Indian MDS exam goes on. I'm just putting it here as an example. Some universities have criteria of taking 75 marks as an exam. Some university takes 100 marks as an exam. To calculate easily, I've written 100 marks and 180 minutes. So each mark is about 1 minute 50 seconds, is approximately 2 minutes. Imagine, guys, any question paper, a model question paper is 2 long essays and 4 to 5 short essays. Depends on the mark division. I've given an example of 100 marks, 25 into 2, and 10 marks into rest of the 5. A 25 mark question, imagine how much time you can give. Approximately 45 minutes. Now in that 45 minutes, what are you going to write? That matters. We're going to see it in later that. And in your 10 mark question, you're going to get approximately 9 to 10 minutes. So those are your short notes. You may find, guys, that we're going to come to that part that writing essay is the most challenging. Everybody tells me, I would say no. Writing short notes are the most challenging because in a smaller area, it's very difficult that examiner expects what you to write in that smaller division of time and lesser marks condition. Because if you are missing on those particular elements, what is essentially important for that answer, you may lose down to a couple of marks together. But when you are writing an essay, you have a lot of time to produce. So chances of getting error is very less. So guys, imagine 25 marks, 45 minutes, 10 marks, about 9 to 10 minutes. Do not exceed your time. Why am I saying this? Is very simple, because there will be some questions in the examination paper. If you're about to write, let's say 5 short note and 2 long essays, 7 questions, out of them 5 you'll be knowing, 1 is like okay and 1 you don't know. So what going to happen is your most favorite question, your just seminar आपने दिया था वो, या आपके best friend के seminar आपने पढ़ा था वो, or something which came in your prelims or some sessional or terminal exam before, which you're really confident with, you're going to start writing first. And by knowingly and unknowingly, you're going to exceed your time because you want to produce the best at first time. And that's a human psychology, guys. You don't want to conserve your any part of energy for your second and third question. You want to give all to your first question. The moment your first question finishes, your energy is down to 50%. Then you start producing for your second question. By the time third question come up, you are all drained. Almost 45 minutes to go. You are down with, let's say, 30-40% of your paper. So now you started compromising it. Now what's going to happen? Imagine, guys, a 25 marker question where you've given maximum of your time. If you've written best, this is not a mathematic paper, guys. You don't get 100 out of 100 here. This is theory. Theory of a lot of concept. Theory of some angle which you must be missing and what I must be seeing. Simple. Example. So out of 25, you may get best is 18, 20, 22 like that, but not full. So guys, just to get 2 extra marks, you've given 20 extra minutes of that particular answer, which you going to totally lose approximately 2 short notes or 1 full question later, which is going to make you regret minimum 15 marks. So guys, time division is extremely important. First, give yourself 5 minutes, divide it, or you can do it at home. Question 1, 2, 3, 4, 5, 6, 7, which is written. Next to it, please write down the time so that you remain adhered to your stipulated time. And what come may, 5 minutes before you start ending your question, in last 2 minutes, you should be just flipping the page to see that what you've missed. And if it is required to fulfill it last in the end, if you get a time, do it. Otherwise, don't keep seeing your paper again, because you start having that second doubt, okay, I would have done that, I would have written this way, I would have done that. Never do that. Rule. Okay, thumb rule, never do that. How to approach the paper? First is, it's a mental game. Do not drain your energy to write. So to maintain energy level, all 180 minute guys, start something with amazingly favorite question or answer of yours is the good. Then hit to the bad one. Then go to the uglier one, which you don't know. Because by that time, your mental energy is there. You can't deal with the ugly, means you can't deal with the answer which you don't know in the end. Till that time, you're fatigued, tired of 2 hours and 30 minutes of exam. Your mental energy is gone and you can't even write a bit about it. So if you take it in middle, there will be a good chance that your recall memory can strike back and you can produce well. And then again, go to the good so that your energy restores what you drained with your bad or an ugly question. So guys, good, bad, ugly, good. So order has to be, write down 1 or 2 questions you know very well, and then good, bad, and then. And even when you're correcting a paper as an examiner, guys, I can tell you, if your first question is the shittiest answer, that's a bad impression you are giving. It is an old saying of making a first impression a right impression. It is true, guys. Everybody in this world lives with perceptions. So if I say first question, second question so badly written, I'm going to start thinking that what this guy must have done in last 3 years, man. He can't even write this answers. The moment I'm going to go to a third answer, my mental energy as an invigilator has gone so much down about you that I'm not going to see the best answer of your life is written as a third or fourth. So I'm going to make your third and fourth as a mediocre answer only because I have already felt that you are an okay person when I'm checking your paper. So guys, the key principle is do not jump on dessert first, salad in middle, and main course in the end, and then you are left with no time. Just make a plan. Start slow, steady, amazing soup and starter. Go to the main course. That's where you're going to write down a lot of stuff which you know, and keep a dessert in the end. That, like example, let's say GIC is such a secure question in paper, clinical periodontics paper. I can't say paper 1 or 2. Every different university has different nomenclature. But let's say GIC is such a secure question that you can write it any given time in your life, like a banded loop space antenna. So save it in the end that you can finish that writing with a little speed and you have only 7 or 5 minutes to go, but you can finish the answer instead of 10 minutes, which should be with you. So that's how it's supposed to be. Writing paper, guys, is a mental game. Good, bad, ugly. Save your energy here to produce well. Why? Because I truly believe in the mental game is like Rocky Balboa. How many of you know this thing? I don't know, guys. You can use a chat box to tell me. I am a big fan of Rocky. And guys, you can put up the questions also. I am going to take your questions by end of the session if I will get the time. Or we can chat it over Instagram. My Instagram handle is drrohanbhat@gmail.com or Dr. Rohan, but you can search me and you can we can chat over that in detail later. So why do I love Rocky? In each movie, in each fight, he says one typical dialogue is one punch at a time. Don't anticipate. Don't overthink. Don't calculate how much you know, how much you are left to write. Nothing. Just start writing one, stick with one, finish, go to second. It's a mental game, guys. One punch at a time, one set at a time, and one game at a time. While you are finishing your game, don't think about next game. Means don't think about the second paper. While you are about to finish the question, don't think about second question what you're going to write, because then you're going to miss out in this same question. Or while you're writing the same question, don't keep thinking how much is left or how much you have to recollect, because there may be one bouncer in the paper which you have to duck and think about it again. So guys, don't overthink, don't panic, don't calculate, don't anticipate, do nothing. It is what it is. This is your question paper, and just zone in, just dive in. And I always say, guys, capsule theory. Behave like you are in a capsule. And we as a dentist, we need to learn that you may come from the most or worst emotional experience of your lifetime, from the family to personal life to anything, or a patient has screwed up your mind. But the moment you start working again, You'll have to get into the zone in and become a person who's working in a capsule that no external thoughts or influence can driven your brain to get it detached from the thing what you are doing. And guys, that is only the key to success. Zone in principle. So guys, the moment you get the paper, you've done the time division, you know what is my 1, 2, 3, 4, 5 in order to conquer the questions in the examination, and then leave it aside. Just don't keep seeing it and keep anticipating. The art of writing is simple. The template is key, guys. You cannot figure out that I will start writing and then I will keep producing whatever comes in my mind. No. First 2 minutes, guys, you'll have to sit with your pen and a pencil with your trash page, that what you're going to write in particular question. Template. Create a template that this is I'm going to write. This will be my base, which I'm going to explain. This will be my comparison I'm going to put. These are the schematics I'm going to involve. Those diagrams has maximum role. And that's going to be in the end, I finish. So template is the key, guys. Do not start writing by keeping things in mind, what you're going to write next and further. That template should be in your brain while you're writing it, because I don't want you to write down, what do you call overwrite it? Because you've given a very long introduction. Then you realize, my God, my time has gone. And then you squeeze down to your main pulp and you have one line as a summary. No, it doesn't work. It has to be absolutely apt what is required. So use a pencil and just draft it. This is what we know it, but we never do it. Why? Because we go in when we know the answer in overconfidence. And that's why we overkill with the time. So guys, learn to break it down, each question you get, in order to make a template in your brain. Now, what do you mean by breaking down questions? Simple. I've just written a very simple question here. Define, classify, explain thumb sucking habit and management of thumb sucking with relevant literature. Now in this, some people think, okay, let me write down those fancy studies and newer generation appliances will fetch me more marks. Some people just classify 7 classifications in that. Some people just explain thumb sucking like there is nothing in their life beyond thumb sucking. And some people give 5 definitions and they think that, okay, I should get full marks. Guys, it's not like that. You'll have to write 1 or 2 most relevant definitions there. So if you break it down, your 50%, okay, in this question, let's take example, they have divided in 4 parts: define, classify, explain, and management. So those first component where the full stop is carries your 50% mark and management carries your 50% mark. Let's say it's a 25 mark question. We are dividing into 12.5 marks, 12.5 marks. Now further go down, explanation and classification means explanation will have, let's say, about 7.5 mark, 5 marks for 1 or 2 classification you're going to write, and let's say about 2 marks for 1 or 2 definition you're going to write. So guys, each thing has each marks. Don't you think that if you write down 5 definition, no classification, you explain well with a lot of studies with the management, and you feel that you've not obtained good marks because you missed out on classification. So each thing is very important and critically relevant when you have to produce in the paper with equal justifiable amount. Don't overdose with something and don't leave anything behind. So write 1 or 2 definition, then write 1 or 2 classification. Then explain thumb sucking, how it works, what are the problems, what are the damages we get. Add in, explain as much schematics, diagrams as you can, so that the person like us who are an invigilator don't have to go and read much in detail, because your examples, your diagrams, your schematics are self-explanatory. And then finally, your explanation of relevant literature. That's where you're going to incorporate a couple of studies to explain what are the new generation methods. Now, people ask me a lot of time that how much to include in a short essay, how much to include in a long essay, how many studies should be there. There is no criteria like this. The number of study equals your marks. But yes, in a 12 marker, 15 marker justified one component of exam, one component of answer in the exam should include minimum 3 to 5 studies, because those much those are the studies you must know for each topic in order to compare it with the older and the newer condition. So guys, that's the baseline. When you are studying now in a first and second year for your maybe rotary system to crown to luting to adhesive to sealant to bonding to etc., minimum 4 to 5 gold standard studies you must know, because that's when your comparison ends, because you know what's done, what's been doing now, and which is the best way to deal with this case later. This is part number 1, where you're bifurcating all the questions and then deciding it by the examiner. Guys, if you write it this way, you're going to obtain the best number of marks. I can promise you that. The second question is very straightforward. No parts. Dental care is epidermis there. Easy. Don't worry, guys, that there is no bifurcation. I don't know how much to add or not. Simple. That means this is 25 marker question. Now, India has 5 zones. So if I will write each zone, explain very well, each zone is going to be about 5 marks in mind. So there also inherently you can divide to write. And then each zone, if you write it down very well, you're going to start getting 3 to 4, 3 to 4, 3 to 4, 3 to 4. And let's say you have 5 zones to explain and you obtain 3.5 marks, or let's say 4 marks in each zone. So you are about to get 18 to 20 marks out of 25, which is amazing in an MDS exam if you could manage to produce well. But do not make this kind of mistakes that you are explaining 2 zones so much in detail and rest of the 2 zones are this size because you did not get time to finish it. So guys, your 2 zone which you explain in detail, you will get you 4 out of 5 maybe. And the zone which you could not reproduce, that maybe give you 1. So eventually you'll end up getting not more than 10 to 12 marks. And that's why you feel that I wrote so much, but I did not get appropriate marks. The reason is simple, guys. You could not mentally understand the game, mentally bifurcate it to create a template and adhere with the template which you have created. And then you missed out on the time and energy both. So further going in detail now to answer each question, I'm going to tell you a simple thing. As I told you before, it's not about the ultimate dish, guys. It's about the recipe. I may make dal, somebody else makes dal, a restaurateur makes dal, big name chef makes dal, but everybody's taste is different. Why? Because it's about the recipe. Recipe is extremely important, guys. Content production is only 80%. Adhering the rest of the things I'm teaching you is 20%, makes you successful with 100%, guys. So follow something is called a layer cake principle. We all have eaten layer cakes, right? One layer of kind of a bread, then comes the sauce, then comes the cream, then comes the fruits or dry fruits or chocolates or something, and then excuse me, it goes on and on. So do you think this layer cake was formed without forming the layers? Absolutely not. Do you think that they manufacture one slot at a time? No. As I told you before, they made one layer at a time. And then second, then third, then fourth. And that's how you should create it. That's where my title today, I put it further and share my Instagram. A lot of people ask me in the morning, the deep dish? What do you mean by deep dish? I said, that's the fundament to go inside to understand the dish, how it has been prepared from base to the top. So to do that, the first rule I'm going to explain is creating template in your mind. So as I've been explaining how to create template, this and that, the whole recipe, you must know. You cannot start cooking and in middle, you have to go on Instagram or open a book to read it again. No, it doesn't work that way. When to introduce what ingredient will go at what time, it must be there in your brain. And that is why I love this quote saying, start with end in mind. In life, guys, even in life, this quote is appropriate. Start with end in mind. If you do not start with end in mind, you just keep writing, keep doing something, you may reach somewhere, but that's not the right destination what you were looking at. That's not a right conclusion of an answer, because you will just conclude it abruptly. Like that Bahubali one, that people were waiting for 2. And I'm very sure you don't want to make 2. That means appearing again. That's why just be in it, format a template, and just know when to introduce what ingredient, means your what part of answer coming here to create that end in mind, create that end what is there in your mind, because it's already there in your mind. So in order to do that, please first create the base. Here your base is going to be those fundamentals which you've learned from the textbook to other materials. So guys, first base is you must know and figure out what you're going to write 70% in that question which is being asked. Don't try to be very fancy. Don't go and read a lot of high grade stuff. Stick to your basis, guys. Don't try to reinvent a wheel, because many times we have seen people studying those drugs of general anesthesia in so much detail, and they fumble even answering local anesthesia. This was just an example, guys. So stick to the basic, create a base which is so rock solid as a foundation about your knowledge. And when you start writing it down, that base should be there, that what you're going to include in the exam time. Now, what is the most essential ingredient? Which goes first? Those are your definition and classification, guys. Every academician, I don't know why, even I and my teachers all love definitions and classification. Now I do understand why, because that's the one way you can understand the topic so much in detail. But guys, maybe some people can memorize it, some people can't. You might have to mug it, write down, whatever. But essential ingredient like the main sauce, if you have to put it on your pizza base, has to be definition and classification. I've never seen somebody's getting full marks where they've written a wrong definition or a wrong classification and the rest of the justification is 100% apt. I've never seen that. So guys, please, because you only know what you're going to write further. So write down your definition classification first and then cook up the story, because as I mentioned before, nobody else today knows other than your own brain by seeing at a question that what you're going to produce in this answer. In your brain, there are 4 legit topics you're going to write down there as a subtopics, but you may end up explaining 3 only, and you felt it is justified for this condition or according to the number of marks and the time which I'm left with. You just summarize it and leave it. So don't worry, guys. Nobody knows you wanted to include 4 and you wrote 3. But everybody will get to know when they are checking the paper that you had to write a definition which is entirely missing. So do not rush to cook fast. Include everything which is important, and your answer has to be like a beautiful story, like a journey. Whenever somebody is just flipping the page, should realize, okay, these are my set expectation about each answer. And my expectation as an invigilator, this person who's written the answer has included those definition, classification, those schematics, those beautiful diagrams. The way they've written is very clean and neat. The flow charts, maybe with any kind of handwriting, guys, I'm not getting into that. And then finally, a good summary, a conclusion. There was a good index in the beginning so that I did get to know what this guy is going to include. So guys, don't rush to cook fast. You may get burned. And don't rush to cook so slow. You may get delayed and there is no pizza left for you. Rule number 5, guys. The rule number 5 is so important, because we feel that I've filled up, let's say 5 or 7 supplement of pages. I've filled up, let's say, about 70 pages of writing in 3 hours. Outstanding, guys. You are like a marathon writer. But guys, what's relevant here is how well you are readable there and how much content which you want. When an invigilator is checking, that exam checker, that paper corrector is checking, should get noticed between mammoths of writing and those English heavy words. So guys, manage to incorporate as many flowchart as you can. Even you can explain your whole theory in a flowchart, so that person has to read that. And you know, flowchart, why do I love it? Flowchart works on a brain algorithm. When you're learning, you know, those early age of computers, which we have learned in our school, which was not relevant, which is absolutely not relevant now. But they also make us do a flowchart system in a computer in order to make a triangle or a square. Because that way also computer takes command and then you can go ahead. Same as a brain function in a real thing is if you put a flow chart that your whole sauce over your pizza is rich everywhere, has an equal taste with the real density over it, and nothing is missed or overlooked in the whole recipe. So your flow chart plays essential role in order to make person like me, let's take an example, if I'm a paper checker, understand that you have included all right things which is apt for this answer. So guys, do not forget one thing, flowchart. You may finding it, oh yeah, we do know about flowchart, but nobody does it. I've seen least paper following this funda what I'm teaching. And then in the end, once you have a template in mind, all the things I've taught, comes the flowchart, you wrote the whole part, then comes your garnishing of your pizza dish. Going more deeper into it is adding quotes, adding studies and quoting authors at the right time. So your author should look like olives, talk like taste like pickle, and simple smell like artichokes. That means if you're writing down those amazing gold standard authors and quotations or citations, whatever you want to call that, make sure you're writing it technically so smartly that those things in that flowchart should pop out in a person who's checking the paper so that it doesn't left unnoticed. Don't just keep rubbing it behind and you tear off the paper, not in that way, but should include so smartly that while they are glancing also those names can keep popping the brain so that my brain thinks, oh my God, this guy's included this also. Oh my God, this also. Very nice, very nice. So when I just finish flipping the pages and come to the last page where I'm going to think in my brain about how much marks you deserve in this answer, the smell, taste, and look of your garnished product with an amazing sauce and a base can fetch you the more than 80% mark you can deserve. So guys, the most important rule number 6 is adding up that. And the rule number 7 is the most forgetting rule number 7. It's the most common rule number 7. And today, while I started the session, I said that I always forget to say thanks to people that matter the most on that particular hour. Because that is our tendency never to summarize and never to create a closure of a story. So if you've written a beautiful answer, summary and conclusion, if you're missing, then that answer is losing out is an essential essence. So do not end a story without a closure. You need to give a closure for the story you've created. That means you need to pack your pizza rightly as you have garnished. Otherwise, if you will not pack it well, that pizza will go stale. So guys, summary and conclusion, maybe you're writing 3 or 4 sentences. It's not another full page I'm asking, but it has to be there in order to summarize what you've written all in 3 to 4 sentences and conclude it. Because it may happen that your flow chart, your diagrams, some or other way invigilator has not understood. And what happens? Simple. You don't get marks. But your closure, that means your summary and conclusion, can fetch you the best number of marks. So don't miss out on that. Don't leave unfinished business. Means do not think that, okay, if I will write about 80 marks of paper, I'm going to write it so confidently, I'm going to get 70 or 60 out of it. No, it's highly unreliable. Please attempt the whole paper so that your probability, your chances of passing and getting good marks is much higher. As I explained before, that leaving a short note is more dangerous rather than writing a long essay more. Do not forget this, guys. Leaving even a short note can make you get short of 7 marks straight. But if you focus more on writing one question more, will not get you more than 1 mark extra. So guys, divide your time and conquer. And while you are reading, guys, and this is my couple of last slides here, is simple. Outer circle to inner circle. Now I told you how to write. I'm not here how to make you study. But guys, I can tell you what is outer circle and inner circle is. Prepare each topic as your 100-marker question. Guys, I'm going to repeat. Prepare each topic as your 100-marker question. You can write down so easily 25 marker. You just need to change the template to this size, like a funnel which is getting narrowed down. And short note is just the bottom part of it. You just have to think that, okay, in 10 marks, if I will write down this relevant 10 things of anything example, which is more than enough to get you 8 or 7 out of it. You cannot prepare short notes separately. You cannot. Now in this session, only to take an example, lasers and MID we just heard. MID itself can come as a 100 marker and laser itself come as a 100 marker question. So you cannot prepare it like 25 marker or a 5 marker short note or 10 marker. Just prepare each question as a 100 marker. Because a lot of people come to me and say, doctor, everything is fine. I've learned everything. You wrote, you explained me about how to write paper, how to bifurcate, what's the ultimate deep dish recipe from bottom to top, how to write flow chart, yeah, everything is done. सब समझाया. पर सर जब वो बाउंसर आता है ना आखिरी दिन का वो 100 मार्क 2 सवाल पूरा दिमाग खराब. Or some universities only 1 question, some university gives 2 questions, maybe 50 marks. Then everything goes bonkers, you know. And what if I don't know that question? Or what if I don't get the option? I said, it doesn't matter. It is going to be amongst your 50, 100 topics which you have prepared. So do not prepare by seeing it. It may come as short note, long note. Just prepare each question that what if this question comes as a 100 marker. That's it. When you're just reading it, just think in your brain, what if this question comes as a 100 marker? And that's where you can narrow down the funnel. That's when you can go outer circle to inner circle, means 100 marker to 25 to 5 or 10. Or 50 marker to 25 to 10. That's where your outer circle to inner circle works. It's simple, guys. Simple, but adhere to the basics. Don't go so fancy. Here on that note, it's about time I finish. I am still 2 minutes to go. Just want to give you a glimpse of the practice where I am right now. There's a waiting area. There's a clinic where I work. We got 6 chairs, central and nitrous, play area, sterilization room, and this is where I'm sitting here. It's a consulting room with lounge and etc. In-house OPG and a lot of stuff. I love pediatric dentistry. I am totally passionate about it. I eat, breathe, drink this subject. I do teach at a college as a professor, and now I am also additional director of the Karnavati School of Dentistry and University as well. And I practice dentistry, guys. So that is what my PhD principle is. And that makes me energetic each day, each hour, doing each thing. So guys, simple outer circle to inner circle, stick with your basic, adhere, same principle your teachers have taught you. And in this generation, Nikhil sir, I would like to tell one more sentence, respect them. I truly love my teacher today. I may have hated them when they were teaching me because I didn't see it, what they were showing me. But the moment, the times when you pass out and you keep conquering those difficulties, you realize कि यार तब ये ऐसा बोला था और ये वही तो था, and you start valuing it. So please respect them. This is highly required at that point of time. And for any other further connect or contact, I'm always most available on Instagram as a Dr. Unward, my handle. And to finish, I'd like to finish with a beautiful quote, which I truly believe in. Nothing can accomplish in life without hustle, struggle, perseverance, and a pinch of luck, guys. So stay blessed, remain lucky, and that's where I'm signing off. And thank you so much for organizers and my modulators to hang on with my full-on story.
Over to Nikhil sir.
Yeah, thank you very much, Dr. Rohan Bhatt, for taking students into the examination hall and telling some very important tips. And we will be taking some questions after the third lecture. So should I introduce the third speaker as well?
I guess I can introduce.
Madam will do that.
Yeah, madam will do that. Okay.
So after that real scintillating lecture by Dr. Rohan, it's my profound privilege to introduce the third speaker of the day, Dr. Nikhil Marva. He did his BTS from CORDS Mangalore and MDS from Bapuji Dental College, Davangere. And also he's done his PhD from MGU, MST, Jaipur. He is an Associate Dean of Mahatma Gandhi University, and he is the Professor and Head Pediatric Dentistry at Mahatma Gandhi Dental College and Hospital. His areas of interest are behavior management and pediatric endodontics. Guest lectures, he's delivered more than 75 at various international and national platforms, and he has numerous publications and research papers to his credit. The awards and achievements are also quite a number. He received the Young Periodontist Award in 2013, Best Outgoing Student in 2004. He is the editor, International Journal of Clinical Pediatric Dentistry, assistant editor of journal by his own university, Mahatma Gandhi University. He's on the editorial, he's an editorial board member of JIS, PPD, JCPD, and WJD. He has authored several textbooks, and including textbook of pediatric dentistry, which has been authored by him. And he's a national executive member, ISPPD, from 2014 to 16. He is member Syllabus Committee of Pediatric Dentistry, Webinar Committee of Pediatric Dentistry, Dental Council of India, and he was the vice president in the year 2018 and 19. And he is going to talk to you all about how to appear in practical exams and Viva Voce. Over to you, Dr. Nikhil Marva. I welcome you to the session. Thank you.
Thanks a lot, ma'am, for the kind introduction. A very good afternoon to everybody, and I believe we can start the presentation now. A very good afternoon to the respected chairpersons. Probably the senior most chairpersons one could expect in a session. As it is said, save the best for the last. I'm glad we are having the best chairpersons for this last 2 days of sessions. As far as the delegates are concerned, I'm sure you must have had an enthralling and a very comprehensive revision of your entire course, which you are going to appear in exam, and you're going to need this rapid revision. And I'm really thankful to ISPPD that they are taking care of all the aspects of a postgraduate program and making sure that such programs are a regular feature of your curriculum. And again, a big thank you to Sharad Ashokan and his team who have given me this opportunity here to speak with all of you on a topic which is actually very close to my heart, is how to prepare in a practical and a Viva Voce exam. Close to my heart because it can be said, been there, done that for everybody. But for those who know me very closely, for those who know what kind of a person I am, this gains much more importance. A small disclaimer before I go ahead, and see, these thoughts are just my thoughts. They can be different to your head or your departmental in charge or your teacher. You can go ahead, discuss with them, because they would have more knowledge, definitely, as compared to mine. Because these are just my thoughts, which I thought will be helpful to you when you are going to give your exam. So what actually happens in an exam? So before the exam, you just eat up everything. And once you are during the exam, you blurt out the entire thing on the paper. And after the exam, your memory goes absolutely zero. And this happens especially after the theory exam. The next day after the theory exam is really boring to say, because we've studied for all these months. And then suddenly we realize that now we don't have anything to do. And it's a blank slate. But this blank slate has to embed the knowledge of your practical and Viva Voce now, which is going to be the next most critical part of your exam. So for the benefit of all those who are listening today, what I have done is I have broken the practical examination into two parts. One is your clinical examination per se, and second is the examination that is based on your Viva component. So I'll try and break up the two and give you the gist of both the things which are going to happen. Let me tell you that I am going to tell you about things which may be asked. It's not a guarantee that they will be asked, but these are the most common things which are usually asked by all the examiners. Before we go ahead and start, always remember the best protocols are initiated in the first. So you should have a nice crisp apron, you should be ready, fully smartly dressed, your operator should be clean, your assistant should be ready, and whatever distractions you want to use for your patient, you should have in hand. Whatever techniques you want to use, whatever behavior modification techniques you want to use for your patients, you must have them in hand. So these are a prerequisite for all the exercises. These are a prerequisite whenever you are starting your clinical practice. And one more very important aspect in a practical exam, which we most of us miss, is prepare your patient yourself. Because when you prepare your patient yourself, you build a camaraderie with the patient. You build a rapport with the patient. But if somebody else prepares it for you, you are going to meet the patient for the first time in operatory. He may not respond in a very positive manner to you because he is comfortable with somebody else. So make sure that you have established a good rapport with the patient by preparing the patient yourself. It is one of the most important yet most often missed thing, which is missed by postgraduates. We often tell our juniors to just prepare the patient for us. No, that's not the correct procedure. We must always make sure that we are preparing our patient ourselves. So as I said, let's break up into exercises you do and the Viva voice. So coming to the exercises which we do, now first is your, most of the times, is your pulp therapy exercise. Now why we mention pulp therapy here is, there are some instances which have happened wherein your case selection may be wrong, and instead of a pulpectomy, you may get a pulpotomy. So it's a pulp therapy basically. So it's a pulp therapy case, depending on your case or your setup. But the ideal thing is we are supposed to perform a single step pulpectomy in this pulp therapy setup. So what you need to have, by setup I mean what all things you need to have in your chamber at that moment of time. Try and place only these things: your presentation sheet, your IOP mounted on the viewer. Please make sure that you mount your IOP on your viewer and you do not give it in the hand of the examiner like, okay, hold it, sir, this is what we have. Always show it on the viewer. This will give a more comprehensive look to your presentation. Your isolation kit with your pre-tied clamp, maybe flossed or tied to the suture material, whatever you are comfortable with. Your local anesthetic agents, whether it's topical or whatever agent you're going to use. Your burrs, your endodontic instruments. All endodontic instruments should be neatly placed. Do not place all sets of files, reamers. Sometimes I've even seen you have little condensers and everything on your burr set there, on everything on your endodontic set. But make sure you have a properly marked endodontic set. Whether you are using H files or K files, they should be properly marked, clean, and well tied with a floss or a suture material for the stipulated length. Your irrigating solutions. Now, this is one of the most important aspects which I think is there, because most of the time we use irrigating solutions with the help of syringe. We use local anesthesia with the help of syringe. And what happens is, in the chaos of the exam or in the tension of the exam, you sometimes do not know what syringe you are picking. So make sure you have clearly marked your irrigating solutions separately. Your irrigating syringe should be separate and it should be clearly marked that way. Otherwise, it can lead in a big complication. Your paper points and your obturating materials, whatever obturating material you are using, whether you are using ZOE or Metapex, this entire thing will create your pulp therapy setup. And of course, these are just some of the snippets which I've given. There may be one or two addendum depending on your operatory or depending on your acumen. You can definitely include them in your set. But make sure that only these instruments are there in the operatory and you do not have other instruments in the operatory. Now, coming to the question answers which could be asked, or the questions which could be asked in respect to pulp therapy, because this is your first interaction when you meet the examiner. And usually what happens is they want to start from the base. So history would be one of the most, history and diagnosis, in fact, would be one of the most initiated or the most started cases wherein they ask you what was the history of the patient and what's your diagnosis, what kind of periapical disease is the patient having, or what kind of, what is your diagnosis. But always remember, caries is a finding and caries is not a diagnosis. So your diagnosis has to be definitive. Now, difference between adult pulp therapy and primary pulp therapy. Your instruments, your regular instruments, whatever you place there, they have to be specific for pulp therapy. Now, instrument-based questions could be asked on each and every instrument, right from your number of the birth to your files. You could have questions on H file, you could have questions on K file, you could have questions on reamers. So the most probable questions here asked is, what kind of a cutting efficiency does H or K have, which is more efficient, which is used in primary teeth? What are the cross sections of both kinds of files? So these are some of the basic questions which are asked with regard to instruments, maybe your lentillar spirals, questions pertaining to local anesthesia, because that is the agent you're using. So a composition of local anesthesia, its mechanism of action. What local anesthesia have you given? Infiltration or block? If it's a block, what's the difference between an INP in an adult and a child? Simple questions, questions which we have been asking you right from the time you enter a postgraduate setup. Questions which always are answered by you, but in the exam time, you are sometimes blank because of the stress of the exam. So the whole purpose of giving this questionnaire to you much before exam is that you are pre-prepared. I am sure all your heads would also be giving you, all your guides would also be giving you some kind of a questionnaire to prepare, but they're just my set of questions I would sometime talk about. Isolation. Again, your rubber dam isolation, the types of rubber dams, types of isolation, quick dams, which are most frequently used now. So the advantages of quick dam over your isolation with the regular rubber dams. These are some of the questions which are going to be asked in the initial setup once the examiner comes to you. So once you've initiated the case and you started your biomechanical preparation, and you take the file X-ray to the patient, to the examiner. So the next set of questions would actually revolve around biomechanical preparations. What is biomechanical preparation? Why do we do it? How different is it to permanent tooth? What is the difference? What files we use? What endodontic instruments? I've already specified the questions you use. What is the role of a floss or a suture material on a file? What should be its length? How do you prevent it? Prevent the aspiration or ingestion of the file? How do you hold it? And probably questions on the working length, because working length measurement with apex locators or manual method, whatever you are using, the shortcomings of apex locators in primary teeth are again some of the questions which could be asked. So once you are through with the file X-ray examination and your biomechanical preparation, and these questions are done, the question next would come most on obturation. So on obturation, you would be getting questions on the material you're using, whether you're using endoflash or ZOE or Metapex or whatever you are using. You could be asked a question on that, their particular combinations, their particular compositions, their mechanism of action, various studies which compare these materials with each other, and then of course the techniques of obturation. There are at least 10 to 15 techniques of obturation. So whatever technique you've used, one, you have to defend it. Second, you should know all the landmark studies which have been done in recent past with respect to the materials used and the technique used for pulp therapy. So these are a must. And in specifically pulp therapy, the questions are going to be asked very straight on, because this is going to be the first exercise. So you should be pre-prepared and pre-ready with all these answers, because it's pretty much certain what the examiner is going to ask you. Coming to the next case would be a space maintainer or a stainless steel crown. I have given space maintainer in this case. So again, what you should have, make sure you have a patient presentation sheet with the intraoral photo, a base poured cast, very important. Normally, we often miss the cast because we think that we've done the model analysis and we've kept the model analysis, and we seldom don't pour the base of the cast. So it should be a base post working cast, properly mounted working cast, and model analysis according to the age of the patient. Please do not go blindly with mixed dentition model analysis, because your patient might not be having any permanent tooth. So you have to do a primary tooth analysis there. So model analysis is one of the most important questions which is asked in a space maintenance setup. What are the types of model analysis, why you have done, and what's your inference? Because your entire space maintainer exercise is based on this model analysis itself. The next question, because you're going to start the case, would pertain to your band materials, the dimension of band materials, the quality of band materials, the width, length, breadth of the band material, the composition of band material. From there, they will shift on to the pliers. So whatever pliers you're having, your bird beak ply, your beak pliers, your hoe pliers, your straight pliers, so questions, universals, optics, three-prong, everything. So you should actually know the number of each plier and the function of each plier once you go into the examination. So there's a beautiful book by Sims, which usually gives those numbers. Of course, you may have other books also which are quoting them, but Sims is where I read from when I was doing my post-graduation. So that is the book which is embedded in my mind, especially with respect to numbers. So you should have that. You should have your spot welder, impression trays. Please make sure you have pre-tried your impression trays, whether you want to take a single side impression or a full impression. That totally depends on your examiner's call. So please don't pre-decide that I'm going to take only half an impression or isolated impression with a special tray. The examiner may ask you for a complete impression. So you have to keep both impressions trays ready, your band stabilizing materials. Now, this is the most crucial step of your space maintainer. This is the most crucial step. Why? Because if your band is unstabilized or gets destabilized while pouring, your entire exercise is going to be waste. By the time you take out your cast, your patient would have already gone and you have to redo the entire thing again. So make sure you stabilize your band very, very carefully. And of course, you have your polishing and cementing materials which you have in the setup. So this is your entire setup which you will have. And if you come on to the question answers which may pertain or which possibly may be asked in space maintainer exercise, we will start with model analysis. I've already told you, you should know whether it's a primary dentition model analysis or a mixed dentition model analysis. You have to be, that is very critical. And since there are a lot of variations in mixed dentition model analysis, which is what you are doing and why you need to know with the articles. Now, classification of space maintainers, basically do not think that if you are doing a panel loop exercise, you only need to know. They may ask you to classify the band material, the space maintainer, maybe classify band and loop, but you should know the classifications of all the space maintainers which is there. So classification of space maintainer is an important question which is usually asked, but often missed by us because we do not think, because we are thinking only of band and loop here, and we forget that there is something as a classification. Factors affecting space maintainer, your bone loss, your time of eruption of next teeth, how much bone loss is taking place within 6 months. All these things are asked and they should be quoted with studies. Now, I'm just quoting a few factors here due to a paucity of time, but factors affecting space maintainer, you have 12 factors, and all those factors are in fact good questions. They are individual questions in their own right. So you should read those very thoroughly and always quote with the literature, always quote with the studies. Your space loss, your space gain, whether your space maintainer is required or a space regainer is required in your case, you need to be very clear about that. Again, as I told you, band material and dimensions are most often question asked. Then another important question, which is one of the favorite of the examiner these days, is band stabilization. Because as I told you before, that is the step where we go wrong. So make sure you quote specific articles. There are plenty of review articles on band stabilization. Do quote all the articles possible, because this will be a question asked at some stage in your viva, whether in the beginning or the end, but it would be asked, trust me. The next question would focus on your loop fabrications, in the sense that what design you have used, where should the loop be sitting on the band, where should the loop be sitting on the crown of the teeth, where should the loop be holding on the canine or the D, whatever that you are using, whether you are doing a space maintainer on 6 or E, that depends. Questions on your space, on your cementing medium. Again, cementing medium is an important aspect, because here you will again have to tell with literature. So questions would again focus on your cementing medium, soldering, welding, and brazing. One of the most common question asked in a postgraduate setup. At the moment you get your space maintainer, the moment you're cementing it, the examiner will most of the time ask you question on soldering, its temperatures, the temperatures of welding, the difference between welding and brazing, or soldering and brazing, difference in various temperature zones which are there. So these are the questions which I want to ask. Now, you may think that sir is telling the question, but sir is not telling the answers, because what I am trying to tell you here is the mindset of an examiner, who is going to interact with you. So I am sure in the earlier revision classes, which have been taken in rapid revisions, or in fact in your own institutions, you would already have the answers to all these questions. But sometimes it is the questions which don't come to the mind. You already know the answers. So my duty here is to tell you questions which could be asked in your practical at the same time, so that you are a little bit aware and open-ended when you are going into the viva situation. Of course, another important question asked is the modification of the space maintainer, what you're using, and there are a lot of literature on it. Now, each and every space maintainer has been modified, and there are very many modifications of space maintainer available. In fact, our chairperson here, Dr. Nikhil Marva, has also modified space maintainer, and it's luckily sir has named it Nikhil's modification, so I can also use it whenever I want. But the thing is that there are so many modifications available and definitive with literature. So you should know these modifications with literature. Follow up of a space maintainer, another part which we often forget during our postgraduate curriculum, but make sure that you mention it, that every 6 months a space maintainer has to be re-cemented, opened, it has to be removed. The entire thing has to be, the tooth has to be properly cleaned, done the fluoride treatment, and then the space maintainer has to be re-cemented. This is the standard protocol which is followed everywhere in 6 to 9 months, but often missed in a postgraduate curriculum. But make sure that you have this answer ready with you, that how are you going to follow this case. So in case the examiner is going to ask you all these questions, you are pretty much aware beforehand of what's happening. The last clinical exercise would be your stainless steel crown. Again, I've already told you what you need to have: your patient presented sheets, your IOPA, your cast, your crowns, pliers. A very important aspect in this is your safety attachments. Now, if you are using crowns with pre-rings, that's excellent. If you're not, whatever safety mechanism you are using to prevent the aspiration and ingestion of crown, maybe it's sticking with a wax or cyanide solution, or maybe mounting, attaching a lingual button and then tying floss to it, whatever. Your safety attachments over here should be included in your clinical setup, as they will give the examiner an idea that yes, this candidate is working with proper safety mechanism. So their faith on you to perform is enhanced. The question of stainless steel crown can be enumerated actually amongst all these exercises. I think stainless steel crown is the most worked upon exercise of all. So you could have questions ranging from indications, modifications, all techniques, but most often the questions with stainless steel crown, the three most favorite parts would be one, of course, all technique, because it is a recent, probably in the last 5 years, I would say it's caught up much. So a lot of research has been done on it. So make sure you read all the research of all technique before you come into the, whether you're doing a hall technique or you're doing a regular crown, doesn't matter, but you should know the entire thing about hall technique, because there is a lot of research is done all over India. So your examiner might be one of the persons who's actually done those, that research. So make sure you have well-documented evidence of hall technique. Okay, the questions here would be mostly pertaining to the tooth reduction, the occlusal reduction, the proximal reduction, whether we should do buccal or not, why we should do, because there are again two schools of thought. One says do and one says don't. So you should have your definitive answers, and your crown reductions, and then your pliers. A very, very important question here. Now, the function of pliers, the function of crimping, your number of the pliers, your the function of contouring, work hardening. All these are standard questions which will be asked when you are going for a stainless steel crown preparation. And I am sure that whosoever has taken the revision class of stainless steel crown must have dealt with all these questions. Because I remember, I want to quote here actually Dr. Anshula Deshpande. She had done in the rapid revision, I think last time, there was a presentation of stainless steel crown by her, and believe me, it was an eye opener. I found so many new things in that. So, your teachers teach you, you get taught from everybody. So make sure you have these, go to the ISPPD database, and I'm sure you will get these presentations which have taken place at the earlier time also. Use them and, get hold of all the information you can on these exercises. Now, why I'm saying this is simple. You will never get a second chance to make a great first impression. So your first impression or your first interactions with your examiners would not be a viva actually, but they would be your chairside vivas or your practical exercises. So make sure that you are fully dedicated to it and fully aware to it, that this is the chance to make the best impression. Now, as I told you, we'll divide it into two parts, your practical part and the viva part. So how to ace the viva or final defense. Now, most of us, when we enter the viva scenario, or maybe 1 or 2 days prior to us, we always think, what could be asked, And the answer is exactly what is there in the slide. Anything. The answer is anything could be asked. It is impossible for anybody to predict the viva questions of any examiner in this world. And if you guys get know-how of this, that if you find somebody who knows the viva questions of examiner, I will be most glad to meet that person, because I've never seen anybody who could prejudge or pre-guess what's the questions going to be asked. But of course, whatever questions are going to be asked from Pedo. So something which you've read all your 3 years, I'm sure not that difficult task. But yes, to predefine the questions, yes, it's a difficult task. But let me minimize it for you. So this is your first entry point. Now you are entering your chamber, your HOD's chamber or your practical chamber, wherever your practical viva is going to happen. So make sure that you are dressed impeccably. You are smiling, not laughing, but you have a confident smile on your face. Now you don't have to smile showing your teeth. Somebody may, but then again, you have to look neat, crisp, clean. Be happy. Do not get a glum face. Gone are the times when examiners used to think that he has come with a glum face. Maybe something is not well with his family or somebody, and then they will give relaxation. No, These days, everybody knows who you are and what you are because of social media. So make sure you are dressed impeccably, you have a good presentable smiling face, and avoid any bright, very bright combinations. Now, trust me, it's quite difficult for those people who wear bright combinations. Somebody like me also, I like to wear bright combinations, but I was lucky enough to be told by my head one day prior to his exam what he desires from me. And I did those things, and I'm happy I could do it, and I could, reach at par at his level or his thoughts, where he knew how to control me. So similarly, I'm sure your heads would tell you or give you a certain advice on how to present yourself to the examiners. And that is the whole point of this slide, presenting yourself, because now that is the first interaction when you are going to come with them. So if you are showing an attitude of confidence, if you are showing good control over your language, over your body language, then automatically your viva starts to do well from there. So don't be fidgety, don't move here and there, don't look into the eyes of anybody, don't look down, but maintain a proper eye contact wherein they are seeing through you actually. So make sure you do all these things before you go ahead. So some basic things. Now, as I told you, it's impossible to define what's going to be asked in the viva, but these are some 3 or 4 things which are asked in each and every viva. Basic definitions of pediatric dentistry, behavior management, caries, handicapped child, any XYZ. Basically, all the definitions which you have in your pediatric dentistry form an important component of your viva, because the minute they ask you a definition and you answer it, they say, okay, half job done. He knows what he's talking about. Again, back to basics. Now, no examiner or no viva will start with the studies. They would always start with a definitive answer, definitive concepts of answers to a particular exercise. So nobody would, actually, it's not that you would sit and they would ask you, okay, tell me the studies of pulp therapy. They would never do that. They would actually go back to the basic, maybe ask you something about a pulpal disease, maybe ask you something about the pulpal management, and thereon, they would go from there to a more complex answer of studies. But it's always back to basics. Make sure you know your dental materials very, very carefully, because most of the times dental materials are also placed in front of the examiners. So make sure whatever dental material you use in pediatric dentistry, you know them in and out, their names, their manufacturers, their compositions, their working times. There was an examiner once, I had an examiner, Dr. Sudeep Singh, where we had gone to a place for exam, and sir had asked somebody, a postgraduate, to mix GIC, and you won't believe, none of the 5 postgraduates could actually mix GIC that properly. Why? Because they were doing it all the time. But when suddenly somebody asks you to do something, you are perplexed. So make sure you have the knowledge of your dental materials, how to mix them, what's the composition, what's the setting time. So you could use all these things. Another very, very important aspect of your viva is your dissertation. Now, you have done your dissertation. So there's nobody else in this world who knows about your dissertation more than you. So make sure you read your dissertation, your theory, your library dissertation, your thesis. Make sure you read them thoroughly, because they are going to be a topic of your viva examination. And if you are not able to answer about your dissertation, then the buck stops there, because they will think that if this person cannot answer a research which he has done himself, how do we, find him capable to answer some other questions? So your dissertation is one of the most crucial parts of your viva. Make sure you read your LDs and your thesis completely before you go, because they are going to form a very big component of your viva examination. But overall, if you ask me, there can be a no pinpoint on the viva questions, but the examiner is going to test your knowledge which you have gained over last 3 years. Trust me, no examiner in this world comes to put you down or comes to ask you specific question. They want to see your knowledge. They want to see what's happening, what you have done in last 3 years, how much of a subject you have gained in last 3 years. And that is why I say they are not testing questions and answers. They are testing your knowledge which you have gained over 3 years. That is the essence of a Viva. Now, whenever I talk about Viva, I always want to put these two things because this is actually which happens. The external's face is like this, and our face is always like a small innocent boy who doesn't know. And these are just some of the memes which we found on net. And I thought because the new generation is now much more comfortable with the social media jokes. So this was one of the things which I absolutely loved, because these two photos were very much depictive of what actually happens in the Viva room or your practical room where you are giving the Viva. But the best part is this: when you come out, whatever may have happened inside, as it is said, what happens in Vegas stays in Vegas. So when you come out of that room, whatever expressions you may have there, whatever answers you have given there, but you always come out and say, yeah, I've done it. I blasted all the questions. They asked me so many things. They told excellent. Nobody will come out and actually say that, I was bomb blasted left and right and I didn't know anything. You will always say that I knew everything. Yes, I have done it. But my only, small request or essence to you is, if you could go in with this attitude, the same attitude which this boy is showing on coming out from the Viva hall, if you could actually go in this with attitude, that yes, I know it, I have the knowledge of the subject, and I am going to perform well. This is the key to performing a good Viva. Your key to success lies in your own hand. Now, if you want to be successful in your practical and Viva, you have to believe in yourself. If you believe in yourself, then definitely your examiner will believe in you. I was very blessed to have, my internal as Dr. Puvakar, who had immense faith on me, but he gave us this attitude. He gave us this confidence that we are right and we could, we could explain ourselves, we could express ourselves. And I am thankful to my examiner, Dr. Shiv Kumar sir, who helped us actually express ourselves and who believed in us, but because we believed in ourselves. So small know-how for all of you: believe in yourself, go in with the attitude that you have the knowledge. Don't go in with overconfidence, but go in with confidence that you have gained some knowledge over the last 3 years. And that will be the essence of your winning the Viva pattern. A small piece of advice to all of you: trust your teacher, because I think if you have the perfect teacher to guide you, you can never go wrong in life. It's not about one practical or one Viva. Your teachers will always continue to be your guides in life. Make sure you respect them and make sure you love them to the last, because they will hold your hand and they will always be there for you, just like your family. A very big thank you. Thanks a lot, everybody, for a patient hearing. Thanks a lot, the chairpersons, for hearing me out. And I am sorry if I hurt anybody's feelings, but I tried to be as politically correct as possible. And thanks a lot again to Sharad for choosing me to deliver this difficult topic, I would say. Thanks a lot. Thank you, everybody.
Wonderfully explained, Dr. Nikhil. It was a beautiful lecture, and especially the way small things were touched upon. Like you said, that the preparation of the patient is very, very important, the first interaction, because if the behavior management of the patient, is done properly, then the patient doesn't become uncooperative, or if the patient once becomes uncooperative, half the game is lost, kind of thing. So that is very, very important. Few tips here and there were really valuable, I would say. Yes, over to you, Sharad.
Yes, ma'am. There are no questions for this session. I think all the students are following either the PhD principle or they're all.
I saw some hands raised, in between.
Ma'am?
Some hand raised were there. Some people were raising their hands. I thought they wanted to ask some questions or something.
Usually we ask them to type it on the Q&A. Maybe somebody wants to talk, then they might do that. Check.
Yeah. I don't know, Sharad, how many attendees are there right now? Combining
Sir,
both.
About here, we can see about 73, sir, and then there are 40 plus in the YouTube link, sir.
So very few, no?
Yes, sir.
But still, no, I just want to add what Rohan and Nikhil has already very beautifully explained, no? I mean, there are some tips, no, that we call it as 10 important tips to write your theory examination as well as appear in practical examination. And I think these tips are prepared thinking that the students know the paper, okay? So I just wanted to narrate whosoever is present, I mean, just for them only, that first important thing is the time management. Rohan has already beautifully explained, so I need not to go into detail. Second is that it has to be very, very specific. I mean, to the point answers have to be given. This is the second important tip because after all, we are not the science students. So we have to be very specific. Third one is what we call it as from known to unknown. So if you have 7 questions in one paper, so start with the question which you know the best. And then until or unless it is specified by the university that you have to go sequentially. So otherwise the from known to unknown is to be followed. Fourth important tip is that do not split your answers. It is seen in many universities that they start attempting one particular question and in between they stop and they attempt the next question, and after say 2 or 3 answers, no, they again continue with the previous answer. So that should not be done because we find it very difficult to evaluate these copies. Fifth important thing is that avoid paragraph writing. I mean, it has to be as far as possible, the point-wise answers should be given. But we have to keep in mind that we don't have to number these points. Instead, we have to use the bullet points. That is also a very important tip. Sixth one is that we have to highlight the main points. Now we can highlight by underlining the important thing, or we can highlight by using highlighter if the university permits. The 7th important thing, I think Rohan has already told that a lot of use of flow charts, diagrams, figures, tables, and quoting the study. Now nobody is asking, or we are not expecting as examiner to just write the reference as per Vancouver's style, but at least you can write down, for example, the Andreessen 2010. So that also itself tells, okay, at least you know about the study. So that is important. And then using the appropriate color while drawing the diagram is also very important. I think we need not to go into detail that all outlines should be marked with the black pencils, and then muscles should be shown with brown, and then nerves with yellow and all these things. No. 8th important point is always leave 1.5 margin all around. Now we have seen students writing from the top left side till the bottom right, so leaving no space anywhere for anything. So that is also important thing. 1.5 inch margin from all around is important. 9th tip is the give little space after every questions which you have finished, so that at least the examiners would know that, okay, you have finished this particular answer and then you are starting with the next one. So this is also important. And last but not the least, that if you don't know the question, make sure you study this very, very properly before you appear for your practical examination. So that is very important, these 10 important tips. And I will just take a couple of minutes now. Similarly, for the practical, appearing for practical and Viva VOC, there are 10 important points. Doctor, again, we presume that you know about the cases. But these are the 10 important things that at least select 2 to 3 cases of each one, for pulpectomy. Don't be dependent on a single case, okay? And always discuss with your faculty and justify whether this particular tooth is a candidate or the particular patient is a candidate for a particular treatment or not. So this is second one. Third one is the special emphasis on the patient safety. And very, very important thing, that tying the floss onto the file while performing pulpectomy. Very important thing. Second is the disinfection protocol. Nowadays, all the higher education institutions are going for NAC accreditation. And this is one of the key features. they always would like to see how much protocol you follow for disinfection and sterilization and biomedical waste management. The fourth tip is before examination, try to find out the answers of each step. What Dr. Nikhil has already explained, that each step you just think in your mind, okay, these are the steps to be followed, and then the answers. Okay, for example, if you are giving an inferior alveolar nerve block, so what should be the amount, what should be the maximum doses which I can give, whether to infiltration anesthesia or a block anesthesia is necessary, that kind of things, you have to just find out before you appear for the examination. Fifth important tip is finish each case in time. Now, what we see as examiners, that they start with a pulpectomy 10 o'clock in the morning and they finish by 3 o'clock. So the patient is also uncooperative, you also become uncooperative and irritated. So that is also the time management is to be followed. The sixth one is while showing your images for working length or some photograph, or you have done the analysis, so kindly delete the extra images which you have taken. So what happens now, that just for working length determination, you take 4 or 5 radiographs and everything is mentioned there. So the moment you come and show it to the examiner, all the images pop up, and then examiners get irritated that how many X-rays you have shot to just go for the working length. So extra images have to be deleted. The seventh one is you must have a very smart assistant, that who can not only deliver the instruments, whatever you require and cements, but also in case you are unable to reply to a particular question, she should be or he should be very smart enough to find out the question and tell you the answer so that you can reply. So when the examiners give you time, okay, I'm coming back in half an hour, you find out the answer. So because you are busy with your cases, so you must have a very smart assistant. The eighth one is the take some drink, with you, keep it for energy. Because most of the time the students get exhausted and your brain absolutely blocks. No, you are unable to reply, unable to do the cases. So something like Glucon-D, which you can sip now after say 1 hour, so that it provides you energy. This is also important one. Ninth tip is that never try to guess. If you do not know the answer, say sorry, because nobody in the world knows everything. So it is absolutely right. You are a postgraduate student. If you don't know the answer, say sorry, sir, I'll just try to find out. That is instead of guessing. So examiners get irritated. And last but not the least is never ever try to argue with the examiner. This is not a right platform to argue with the examiner, either the external or the internal. So these are 10 important tips. So I just thought I should discuss with all of you, and of course share with the postgraduate students. Sharath.
Thank you so much for that lovely tip, sir. I think I like the last tip the most, not to the examiners, where to
absolutely.
keep it. Thank you so much, moderators and speakers, for that lovely session. So may I now request the moderators to present a token of appreciation to our speakers. First to Antamai.
Mashmi-ji.
Yeah. Dr. Antamai, please accept your certificate of appreciation for the wonderful lecture which you have.
Thank you so much, ma'am.
Thank you, ma'am. Thank you, Dr. Antamai. Can we have now a token of appreciation to Dr.
Mashmi-ji, please.
Let it come on the screen.
I'm clicking the picture.
Okay.
So, Dr. Rohan Bhatt, please accept the certificate of appreciation. It's an honor for me to hand it over to you.
Thank you. Thank you so much, ma'am. Pleasure is all mine. Thank you. Thank you, all of you.
Thank you, ma'am. Certificate of appreciation to Dr. Nikhil Marva.
Yes, Nikhil, it is my proud privilege to present to you this token of appreciation for your hard work and tips which you have given to our postgraduates. Kindly accept it on behalf of whole team.
Thank you, sir. Thank you for the opportunity and all the love and affection and special tips. The tips which you gave, I could never give. I think you are the right person to tell them.
Thank you very much. Thank you. Thank you.
Were you able to see the certificate, sir?
No, not yet.
Not yet.
You always do this with my certificate somehow.
Yeah. Now I'm going to keep it for myself.
And now I can say. Thanks a lot. Thank you. Thank you, Sharad, once again. Thank you, ma'am.
Yeah. So last speaker gets it last, right?
Yeah.
So, Sharad, before we end, just like to say something.
Yes, ma'am. I wanted to ask you whether, as a president, you want to tell something. So we wanted to ask you.
I really wanted to.
Yeah, but can we give the certificates to the moderators and then we ask you? So my job is done. Yeah. Request all the speakers and Nikhil sir to honor our First Lady, Mausumi ma'am.
Yeah.
Yes.
So, Mausumi, again, as a president, it is our privilege to present to you this certificate of appreciation for being moderator of this particular session. Very important session. Kindly accept on behalf of all the speakers and on my behalf.
Thank you so much. Thank you. My pleasure.
Thank you.
Thank you, sir, and thank you, ma'am. And now to Nikhil, sir.
So, Dr. Nikhil, yeah, it's a profound privilege, really, and great honor to give this certificate of appreciation for all your organization skills and, of course, your hard work and vision.
Thank you, Mausumi. Thank you all. Thank you very much.
Thank you so much.
Can I say a few words, sir, before?
Yes, certainly.
Yeah. I just want to show my team because everybody thinks that we have a lot of people here. Actually, we are 4 of us sitting in KSR IDSR. Dr. Geeta Priya is here with me, the head of the department. So thank you, Dr.
Yes, hello, Geeta Priya.
Hello, sir.
Yeah. And there's Dr. Sudandra and Dr. Yogesh. So this 4 of us who have been.
Okay. Hi, Sudandra. Hi, Yogesh.
Yes, sir. And Dr. Prasad, who's been helping us create the link and pass it on. Thanks to Dr. Shivakumar sir, silently he has helped us do some ground and this thing. So he wouldn't want to mention that, but thanks to him again. And thanks to the Uniglow team, Ramesh and Sai. Thank you so much for the technical support there. Sai, thank you so much.
Thank you.
So it's an honor and privilege for KSR IDSR. We've been helping organize this program, but this time we thought when we got an opportunity to host it from our college directly. So we grabbed the opportunity. Thanks to the president and secretary, sir, for trusting us and giving us the opportunity.
No, but the great job done by all of you, the team. A big clap to you. I know it's very difficult to hold these kind of, events. A lot of hiccups.
Thank you, ma'am and sir, for this great opportunity, allowing us to host this prestigious event of ISPPD. Thank you so much.
And that's so wonderful. I think we can have Sai on the screen also.
Yes, sir. Sai, can
people at least recognize you?
Yes.
Yeah, sir.
Please switch on this thing.
Yeah.
We had some first day. We had some technical issues. We had to sort things, and then we said we will play the video, and he'll stay there as backup. So he has really done a wonderful backup job for us. So whenever we he did that. Thank you, Sai.
Thank you very much. Thank you, Sai. Thank you very much.
Thank you, sir.
Yes, sir.
So I think we should go for valedictory.
Yes, sir. So can we request our Vice President, Dr. Parimala ma'am, to say a few words and thank the gathering.
Good evening to one and all. Myself, Dr. Parimala, Vice President of Indian Society of Orthodontics and Dentistry, on behalf of President Dr. Mausumi Madam and General Secretary Dr. Nikhil Srivastava and all the office bearers, I am honored to extend my gratitude to our chief guest, Dr. Figan Seaman, who spared her valuable time in inaugurating the 3rd Virtual Rapid Revision Summit. Thank you very much, ma'am. At the outset, I would like to thank Dr. Sharad Ashokam, Dean of KSR Dental Institutes and Editor-in-Chief of Journal of ISPPD, and Dr. Geeta Priya and her team for making this event a grand success with their untiring efforts and time. I am grateful to all the speakers who shared their valuable knowledge in uplifting spirits of our postgraduates for the forthcoming examinations. Thank you, one and all. Also, my sincere thanks to all moderators for managing all the sessions successfully. Thank you. My special thanks to all postgraduates from all over India for registering in large number and contributing for the success of this event. Last but not the least, the IT team who extended their best services for this event to happen. Thank you one and all. Jai.
Yes, sir. So, over.
No, before we finally sign out, I request the President, Moshmiji, for her just concluding remarks and present a token of appreciation to Dr. Sharath and Dr. Geeta Priya. Moshmiji, if you're there.
Yeah. Ma'am, can you hear us, ma'am?
What happened? She is here, no?
Yes, ma'am. Should I call her, sir?
Yeah, I think. But in the mind, if you permit me, in absence of, she's connecting, I think, she's trying to connect.
I think she's trying to connect.
Yeah. Moshmiji, can you hear us? Please unmute yourself.
Ma'am, you can now unmute yourself. I made you the co-host.
I think she's finding it difficult. But I just like to inform whosoever is present right now that you can download your certificate of presentation from your profile page from Monday morning onward. So our IT team will take another 2 to 3 days to prepare the certificate of participation, and you can download it from Monday morning, right? And the second important thing is that when you download, you will get a feedback form. So that will be mandatory for you to fill up. First, you fill up your feedback form, and thereafter you'll be able to download your certificate. So this feedback form will help us, improving ourselves in future events. So this I just wanted to inform everyone. And Sharath, also, kindly let me know the names of these 2 assistants, from your department,
yes,
who
sir.
worked along with you. So we will just give them also a certificate of appreciation.
Yes, sir. Thank you, sir.
All right. So if I think Dr. Moshmi is unable to join. So in the meantime, can I request IT team to just display the certificate of appreciation to Dr. Sharath Ashokan and to Dr. Geeta Priya? Moshmi is calling, I think. All right. So this is Dr. Sharath. Again, it is my privilege for you to present to me to present to you the certificate of appreciation for your hard work, and you really made it possible. I know being a dean, it is very, very difficult to engage yourself for continuously 5 or 6 days, but you did it very nicely, ably assisted by your team. Thank you. Kindly accept it.
Thank you so much, sir. Except for the first day's technical glitches, I think we sailed through, sir.
Thank you. Moshmiji has come now. Moshmiji can
I'm
present to
sorry
Dr.
that my internet connection is actually not allowing me to do this. But it's gone a little weak. But after really 4 days of intense, revision classes, we have come to the culmination of this rapid revision program, and all the hard work of Dr. Sharath and his team just cannot be underestimated. It's been tremendous from their side, tremendous contributions. And of course, the wonderful speakers which we have had, I don't know how much the students listen to them, but we as faculty members just enjoy listening to all these things, and small tips here and there. Every day, we also as faculty members are growing and listening to these people, So it's always a learning experience, and I hope ISPPT will continue with this endeavor of theirs of getting this rapid revision done every year. And I'm sure this was the vision of Dr. Nikhil, and we must appreciate it highly, because this is something for because of which the postgraduate students will And we feel that they are going to really benefit immensely because they are not exposed to all kind of teachers all over the country. You know, when you really get to listen to all the teachers on various aspects and various subjects, you know, you feel so very, armed. You feel so very strong and reinforced of the ideas and of the concepts. So that is the beauty of this rapid revision. And I expect ISPPT to keep on holding it every year. Sure. And my sincere thanks and gratitude to all the speakers, to all the moderators who have been part and parcel of this project, I would say, or the summit program which we've had. And yeah, definitely small tips here and there for the postgraduate students. My wishes and good wishes and immense blessings to you all. Please do your papers nicely, and I'm sure you all will come up with in great colors. And of course, we'll join the faculty team in next few years. So
yes. Very good. Right. Thank you very much, Moshmi. And kindly present this certificate of appreciation to Dr. Geeta Priya.
Yeah, Dr. Geeta, you've done a wonderful job, and I must appreciate it highly. Please accept this certificate of appreciation on behalf of ISPPT.
Thank you.
Absolutely. So wonderful job, KSR Institute of Dental Sciences, whole team, Sharath, Geeta Priya, and the complete department.
Yeah, I can see Dr. Kumar over there also.
Yeah.
Sir, please show up.
We just added him because he actually gave up the way for allowing moderators. So we thought at least we'll have him in for the last day, sir. Actually, he
sir,
good evening. Silently as usual. So.
Yeah.
So nice to see you there.
Yes, absolutely.
Actually, I didn't want to come. And he was trying to put me in.
No, but it is all
on the backstage, sir. Like,
yeah. And he always works on the backstage.
No, I told that also. Like I'll be in the backstage only this time.
Yeah.
Good to see Nikhil Marva as a professor in his room. I told you.
Yes.
No, typical. We don't see him like that outside.
Yeah. So Amira becomes the benchmark.
I was made to sit in the room by Sharath sir. I was actually roaming around here and there.
Rohan is used to sit like that in front of his shelf, but you are not used to sit like this. That's what I said.
True.
Hello, sir. Nice to meet you. Nice to see you.
Good job by all the people.
Thank you. Thank you, sir.
Thank you, sir.
Thank you.
Thank you.
Thank you so much. Thank you, sir. So I think this is the time we should sign off.
Yes, sir. Yes,
Dr. Sharath,
yes,
anything you want to say?
National anthem or something? Do we have something?
Thank you so much, Dr. Sharath, for agreeing with me. My guts. I know I'm a little tricky to do that, but just work out. So thank you so much, guys. Thank you, Dr. Nikhil. Both the Nikhils. Long time. Thank you, madam. We'll see you soon. Thank you. Thank you so much, sir.
I think is there any Vande Mataram on national anthem, Dr. Sharath?
Yeah,
I think you have done it in inaugural session, right?
No, we didn't do it, sir.
We didn't do that.
Anthem thing here. If you want, we can play that and we can finish.
Yeah, we can just play it before we finally sign out. Huh?
Yes.
Thank you so much for giving us an opportunity. I'm driving, so I put my video off. Thank you so much. I just tried my best, whatever I could, and it was really nice to get the tips from Nikhil sir for Vivas as well as practicals, because for me, it's very new for us to get into the question answer format and questioning the PGs and framing their questions and everything. So thank you once again. Thank you, Sharath sir. Thank you, Shiv Kumar sir. And thank you, Mossmi ma'am, and thank you, Nikhil sir, for introducing me. Thank you so much.
Thank you, Abdurrahman.
Thanks to the head office and the entire team for giving us the opportunity again. So we've come to the end of this 4 days rapid revision version 3.0, and we will finish this whole session with national anthem. Thank you so much.
Thank you.
जनगण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल बंगा विंध्य हिमाचल यमुना गंगा चञ्चल जलधितरङ्गा तव शुभ नामे जागे तव शुभ आशीष मागे गाहे तव जय गाथा जनगण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे जय हे जय 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 हे
Okay then, bye.
Yes, sir.
Bye, Sharad. Once again, thank you very much. Thank you, Moshmi ji. Thank you, everyone. Thank you,
Thank you,
Geeta
everybody.
Priya.
Thank you.
God bless.
See you soon.
Bye.
Bye. Bye.